I'm Lila Lazarus. If you had a confirmed case of COVID-19 and are fully recovered, you have an opportunity to help find a treatment for this virus by donating plasma. The thought is, if you tested positive and are now fully recovered, you may have antibodies in your plasma that can attack the virus.
Convalescent plasma is in limited supply. So the treatment really is based on the generosity of donors right now. And if you are healthy and have recovered from COVID-19, then yes, of course, we encourage those patients to donate if they can and if they are willing, because it is possible that you may end up saving a life.
The hope is that you get patients to do better with respect to COVID. We know that convalescent plasma has antibodies, or that's the presumption, is that you're giving people antibodies from donors that have recovered from COVID. So there is a bit of a supply and demand, meaning that there's not enough, we don't have enough donors at this time to give it to all patients. Anecdotally, we've seen previous experience with SARS and MERS and even Ebola, where there has been success with convalescent plasma. So right now, there's probably thousands of patients across the country that are receiving this. And we're trying to kind of collate the data and collate the response and try to see if there's benefit.
This convalescent plasma could be life-saving treatment for patients with serious or immediate life-threatening COVID-19 infections. Jordan, when did you get sick?
About a month ago.
And once you recovered, how did you find out about this whole plasma thing?
Dr. Mohammed Arswala called me. I read some random articles, and then Beth Lavasser called me.
When Beth Lavasser called you from St. Joe, what did you think?
It just seemed like a really, it kind of seemed like a no-brainer, to be honest with you. It sounds really promising from what they said. And we, as our family knows a couple people personally who did end up in the ICU on a ventilator for a while. So just the fact that, anything to help out, go to the Red Cross. There's a form you can fill out sort of identifying yourself as a potential donor, and they'll get in contact with you. It is a pain-free process, and there has been just a lot of promising news. And the more I've looked into it, this plasma therapy could really be an effective treatment, both for those that have mild symptoms, but also the people that are in the hospital and really need it.
At St. Joe's and Mercy Health, seriously ill COVID-19 patients were among the first to receive plasma from those who've already recovered.
My hope is that every single person in Michigan and probably around the country goes and does this. And if it does prove to be effective, I think those numbers can really start to come down quick.
If you tested positive, recovered, are now healthy, you're at least 17, and you weigh more than 110 pounds, consider donating today.